Hi everyone, we are starting with the subject pharmacology. I hope you are aware about the term pharmacology. It's all about the drugs. So we are starting with some definitions. It's a bit boring, but kindly cooperate. So shall I start? With your permission, the definition of pharmacology. So it's derived from two Greek words, pharmakon, which means drugs, and logos, the science, or in exactly the disclosure in. So it's all about the drugs. But by definition, it should be in detail. It's a branch of science which deals with the study of drugs, including its mechanism of action, how the drug acts in our body, and what effects they produce in various organ systems. That means what effect on the heart, what effect on the blood, or what effect on GIT or in the CNS, and apart from that, what all side effects, unwanted effects they can produce in our body, and how they are useful for treating or reducing a particular disease condition. And also it will include other all aspects related to the drugs, in the sense what is the source, how it is being prepared. All those aspects are also included in the term pharmacology. But in short, you can define it as branch of science which deals with the study of drugs, including the mechanism of action, effects on various organ system, side effects, therapeutic uses, as well as other aspects of the drug. So the drug, the term drug is from the French drogue, means a herb or a dry herb. So the drug is being defined as per WHO, World Health Organization. It is being defined as any substance or product. Any substance in the term, like it may be a mineral or a chemical substance or a product which is being produced by the animals or from the plant sources or being synthesized, that is used or intended, means we are planning, intended to be used for diagnosis or mitigation. Mitigation means to reduce the severity of a disease, like cancer. Sometimes it is not completely curable, or in auto AIDS, where it is not completely curable. We can reduce the severity of the disease, or for prevention, what we call chemoprophylaxis or prophylaxis, to prevent or protect the patient from the infection. Nowadays we are hearing about COVID vaccination and all. So the prevention from a particular disease, or treatment, complete cure of a disease, like because of tuberculosis or leprosy, it is completely curable. Pneumonia, it is completely curable. So treatment or cure of a disease for the benefit of the recipient. So any substance which is given to a recipient for his benefit in terms of a diagnosis of a disease, or to reduce the severity, that is the mitigation of the disease, or to prevent or protect the patient from a disease, or to treat or completely cure a disease, is what we call a drug. So let us see what are the sources of drug, from where we all get the sources. So here you won't get any write-ups. Kindly note down in your note from my audio. So sources, we get it from the natural sources, like plant sources. You may come across so many things. Usually in class, students used to tell morphine. It is obtained from opium. It's a natural source. Or you get cinchona alkaloids. So morphine will be an easy example for you. Morphine obtained from opium is a natural source from plant. And we get various drugs from the animals. So if you see the, like heparin, you might have heard of heparin. It's an anticoagulant. It is obtained from ox, lynx, or pig intestine. Or another example, if you go insulin. Earlier we have two insulin, bovine and porcine insulin. Bovine, which is obtained from the beef, which is not now in the market because of hypersensitivity reactions. But porcine insulin, which is obtained from the pork or pig, it is still available in the market. So that's another example for a drug which is obtained from animal sources. Another source is microorganisms. So classical example, penicillin. You know, penicillin is obtained from Penicillium notatum, but commercially it is obtained from Penicillium chrysogenum. That is a classical example for drug obtained from microorganisms. Then so many minerals which is seen in the nature we use as drugs, like calcium or magnesium or even iron, for iron deficiency anemia, calcium for osteoporosis or calcium deficiency or during increased requirement like pregnancy or lactation. So just note down few examples: calcium or iron or sodium. Next is synthetic sources. By chemical reaction or by synthetic method we are producing some drugs, like very commonly known drug paracetamol. It is obtained by a chemical reaction or it is synthesized by chemical reaction. Then genetic engineering. This is now the new updations or the latest updations for the last few years, like genetic engineering. We are introducing our own gene into some microorganisms so that the microorganism will synthesize the same protein which can be utilized as a drug. The classical example is human insulin. Earlier I mentioned porcine or bovine insulin, that is from the animal source, but human insulin, we are introducing the human gene for insulin into E. coli, and E. coli will synthesize insulin which is exactly similar to human insulin. So human insulin is a classical example for a drug produced by genetic engineering. And I mentioned one more source, that is hybridoma technique. Nowadays it is coming to be very common, that is the production of monoclonal antibodies. Classical example you might have seen RHOD immunoglobulin, that is used for preventing erythroblastosis fetalis. So many monoclonal antibodies are in the market. Usually they ends with the 3 letters MAP. Omalizumab is another monoclonal antibody. So monoclonal antibodies are gaining more importance in cancer chemotherapy as well as in treating various infections. So the sources you can write down as natural sources as a heading, followed by from plant. We get drugs from the plant sources. Example, you can give morphine from opium. From animals we get drugs. Example, bovine or porcine insulin or heparin from oxalates of pig intestine. Then minerals, we get drugs from the nature, from mineral sources like calcium or sodium or iron. Then synthetic sources, you can write paracetamol obtained by the chemical reactions or synthesized chemically. Then genetic engineering, you can write the genetic engineering is used for synthesizing the drugs like insulin, human insulin, you have to specifically mention human insulin. Then monoclonal antibodies by hybridoma technique. So, drug categories. The drugs are categorized into various classes, like non-prescription drugs or OTC drugs, that is over-the-counter drugs, OTC, over-the-counter drugs, which do not require any prescription for getting the drugs from the pharmacies, community pharmacies. So you know that many of the vitamins, antacids, they do not require any prescription from the registered medical practitioner. Prescription drugs. So these are the drugs which require a prescription from a registered medical practitioner. Without that, the drug is not supposed to be dispensed or not supposed to be purchased. So they require a prescription from a registered medical practitioner. Example, like antibiotics, anxiolytic, antidepressants, etc. Though in our state it's not practiced exactly like that, but it's supposed to be prescription drugs only dispensed under prescription. Orphan drugs, as the name tells, orphan. So these are some drugs which are used for treating very rare diseases. So that means it may be affecting one person in a million or in a trillion. So such drugs, if you introduce or if you manufacture or if any company manufactures such drugs, there is no financial benefit or gain from the sale of that drug, because that may be useful for one person, maybe all over the world it may be useful for only one person. So such drugs manufacturing will be supported by WHO, and such drugs are known as orphan drugs. One example is octreotide for acromegaly. Prodrugs, the term itself, pro before the drug. Prodrugs. There are some drugs which are not absorbed completely from the GIT, because usually oral route is the most preferable route of administration. So some drugs may not be absorbed completely by oral route. They may be destroyed by the gastric acid, or may be destroyed by the enzymes in the GIT, or may be destroyed by the hepatic enzymes. So such drugs will be chemically manipulated so that they are not affected by these enzymes, but they are activated either by these enzymes or by the hepatic enzymes to a original active form, so that the only active form of the drug will be available in the blood in the complete amount. So prodrug can be defined as the inactive form of the active drug. Kindly note down, prodrug is defined as inactive form of an active drug which is activated within the body either enzymatically or chemically. I repeat, the prodrugs are those drugs which are inactive form of the active drug, which are activated within the body either enzymatically or chemically into the active form. The classical example is L-Dopa. So L-Dopa is a drug used for Parkinsonism. So what we require is dopamine should be delivered into the brain, but we cannot give dopamine as such because dopamine cannot cross blood-brain barrier. That is one reason. Second reason, dopamine, if it is given as such, it can cause various side effects, especially cardiovascular side effects. So we develop a prodrug, that is L-Dopa, levodopa. It can easily cross blood-brain barrier, and once it reaches the brain, it is converted to dopamine by the enzyme dopa decarboxylase enzyme, which is present in the brain. Another example is enalapril. It is used for hypertension. So enalaprillate is the active form. So enalaprillate cannot be given as such because it is not absorbed completely. So it is converted to an prodrug which is metabolized in the liver to enalaprillate. So the enalaprillate will be available in the blood in the complete form. Placebo drug or medicine. Placebo in term of a drug or in virtue or in grab of a medicine. That's the meaning of placebo. Placebo drugs means the drugs which are given in grab, G-R-A-B, in grab of a drug or medicine, which do not have any pharmacological actions, only psychological effect. Say like some example, if a patient is having so much of confidence or highly impressed with a physician and is complaining about a severe headache which is there for last 6 months, and no drugs is not able to relieve this headache, and the patient approaching a physician whom he is having high confidence, and the physician is giving some candy in terms of a drug and tells him take it 3 times a day, and because of the impression on the physician and confidence on the physician, the patient get relieved from that particular headache. So such drugs we call it as placebo drugs. So understand the definition. Placebo drugs, these are the substance which are given in grab, GRAB, in grab of a medicine which do not have any pharmacological action but only psychological aspect. Drug nomenclature. The drug can have 3 names. That one is chemical name as per IUPAC naming. You know, you have studied chemistry, how it is being named as per IUPAC, and non-proprietary or generic name. So these are the names which are used uniformly throughout the world by an international agreement with the WHO. So that means a particular drug will be having the same name throughout the world. So generic name can be used in any part of the world, you will get the same drug. And the third name for the same drug will be a proprietary or trade or a brand name. So this is a name which is given by the manufacturer. So the manufacturer can give any name. For example, paracetamol. It's a generic name. So you go around everywhere except US, it is known as acetaminophen, but otherwise anywhere in the world, if you go and ask paracetamol, you will get paracetamol. But it is manufactured by USP and it is being named as Dolo. And the Dolo, the drug, the paracetamol, which is named Dolo, may be available in India or some of the countries, not in all the countries. But paracetamol will be commonly known name for the drug, and Dolo is the name given by the manufacturer. So easy example I am giving here, aspirin. It's a well-known drug. So generic name is aspirin, while chemical name is acetyl salicylic acid. While when it is manufactured by USP, it is known as ecospirin. So this is important. Kindly note down. It can be asked for exam. The drug nomenclature, or what is the difference between a generic name and a brand name. So generic name definition is already given there. Brand name means the drug which is given by the the name which is given by the manufacturer for the drug. Branches of pharmacology is only for the sake of definition. You can just go through that: pharmacy, the science of identification, selection, preservation, standardized compounding and dispensing of medical substances, pharmacotherapeutics, chemotherapy, toxicology, pharmacovigilance. So I come with pharmacotherapeutics. So make it very simple. It is the use of knowledge in pharmacology in treatment. So make it very simple. Don't by heart anything. Pharmacotherapeutics. Knowledge in pharmacology, that is pharmaco. In therapeutics, that is treatment. So pharmacotherapeutics, the definition form, it's a use of knowledge of pharmacology in treating a particular disease. Chemotherapy, it's important. Kindly note down the definition. Chemotherapy is a common term used for cancer chemotherapy as well as antimicrobial chemotherapy. So the common definition becomes, it's a use of drugs or any substance for treating malignancy or infection which are having selective toxicity against the malignant cell or the invading microorganism with no or minimal effect on normal cells or the host cell. So the definition is clear. Chemotherapy, using chemicals, you are treating malignancy, let it be malignancy. So the drug will be only toxic or cytotoxic. It kills only the malignant cell but not the normal cells. While coming to antimicrobial chemotherapy, it's using chemicals or drugs which are toxic, cytotoxic, or kills the invaded microorganisms but not the host cell where the microorganisms are present. The host cells are not affected, only the microorganism will be affected. So kindly note down the definition. I repeat, it's a usage of drugs or any substance for treating malignancy or infection which are having selective toxicity against the malignant cell or the invading microorganism with no or minimal effect on normal cells or the host cell. Toxicology is the next definition, next topic. So toxicology is nothing but toxicity. So it's a study about the toxicity of the drug. Simple definition: study of toxicity of the drug is known as toxicology. And pharmacovigilance, this is gaining importance nowadays, and the nurses plays a major role in pharmacovigilance, because once a drug is introduced or a new drug is introduced in the market, or even the old drug which is there in the market, they may show an unexpected adverse effect in the patients. So it is all about identifying and responding to the issues of drug safety. So here the role of nurses become more important, because nurses are always very much close to the patients, observing the patients every time. So the nurses will be able to identify the unexpected adverse reactions of a drug which is newly introduced or already there in the market, and it has to be reported in a particular format to the pharmacovigilance department so that such issues can be avoided. So basic concepts of pharmacology. Here we comes exactly what into pharmacology. We are getting into pharmacology topic. So there are two basic concepts of pharmacology. One, it is known as pharmacokinetics. Kinetics means movements, right? So pharmacokinetics is the movements of the drug. So where the drug moves through the body, and how the drugs moves through the body, that is done by the body. So the definition becomes what body does to the drug. What the body does to the drug. So in the figure you can see ADME, that is absorption, distribution, metabolism and excretion. So you kindly note down the definition, it is not there in the slide. It is the quantitative study of movements of the drug through the body. It is the quantitative, that is in amount, how much, quantitative study of movements of the drug within the body. For example, it is absorption, that is how much is being absorbed, distribution, how much is distributed throughout the body, metabolism, how much is metabolized, and excretion, how much is excreted. In short, you can mention what the body does to the drug. So when pharmacokinetics is being asked, kindly pharmacokinetics, you define it as it's a quantitative study of movements of the drug within the body, and in inverted commas you can write what the body does to the drug. Example, it is absorption, distribution, metabolism or excretion. Second is pharmacodynamics. Dynamics, the dynamic personality, what we used to call dynamics, the energy with the drug. So it's all about the drug, what the drug does to the body. So the drug, once it is administered, it can either decrease your elevated body temperature, it can decrease the heart rate, or it can increase the heart rate, it can decrease or increase the GI motility, it can inhibit a particular enzyme, or it can activate a particular enzyme. So these are the things what a drug can do in our body. So kindly note down the definition for pharmacodynamics. You have to define it as follows. It is the biochemical effects of a drug produced within the body. Or in detail, I repeat, it is a biochemical or the physiological effects of a drug within the body. Define it as it's a biochemical and physiological effects of a drug in the body. In inverted commas you can write what the drug does to the body. For example, atropine, I hope you might have heard the drug atropine. It increases heart rate. Or if you see adrenaline, that's well known, you might be knowing better. Adrenaline, it increases heart rate, it increases blood pressure. So you can remember such adrenaline, what the pharmacodynamics of adrenaline, it increases heart rate, it increases blood pressure, it increases it produces bronchodilation. So that can be given as example. So I repeat again, pharmacokinetics, it is a quantitative movements of the drug within the body. Inverted commas you write what the body does to the drug. Example, it's a quantitative study of absorption, distribution, metabolism and excretion, ADME. Pharmacodynamics definition, it's a biochemical and physiological effects of a drug in the body. Inverted commas you can write below what the drug does to the body. Example, adrenaline, it increases heart rate, it increases blood pressure, it produces bronchodilation. So before getting into that, we are just starting with the pharmacokinetics. So before absorption, the drug need to be administered. So there are various routes of administration. So I know you know better than me what are the various routes of administration. So kindly go through that, but I prefer you follow my particular classification when you write for pharmacology exam. So there are two main routes. One is local route, another one is systemic route. Local route means the drug is supposed to act only locally, not in the entire body. Systemic route means a route by which we are delivering a drug so that the drug reaches systemic circulation, that is the blood, so that the drug can reach almost every part of the body. So local route, one example is topical application, like creams, ointments, what we apply locally in a particular area for relieving pain also. And deeper tissue injection, we are injecting some drugs into a particular area of the body, deep into a particular area, so that the drug will be acting only in the area of injection. Systemic route, oral route. Many times students right, oral route is a local route. No, oral route is a systemic route, because anything which is being taken orally will be delivered from the stomach or small intestine to the hepatoportal vein to the liver and finally into the systemic circulation. So oral route is a systemic route. Parenteral administration, parenteral, other than oral route. So IV, intravenous, IM, SC, intrathecal, etc. are known as parenteral route. Transmucosal route, that is through the mucous membrane, though we are keeping the drug locally, but the drug is absorbed through the thin mucus layer in that area directly into the blood, like sublingual, under the tongue. You might have seen the place under your tongue. You can see so many blood vessels and only a thin layer of mucous membrane. So if you keep a drug under the tongue, the drug will be easily penetrating the mucous membrane because it is a very thin layer and directly enter into systemic circulation. And like that, transvaginal and transrectal route. Inhalation, if you inhale either through the nose or through the mouth, the drug can be directly delivered into systemic circulation, but to some extent it will be locally acting on respiratory system. Miscellaneous is TDDS, that is transdermal drug delivery system, that we call the attachment of patches. We are sticking some patch into the skin so that the drug will be delivered slowly through the skin into the systemic circulation. So this is a major classification of routes of administration.